Knock, knock. Hello. Hi. Do
We got the whole game here today.
Oh, yes. We are nurses from NTC, student nurses. So we're just here. Is this little Miss Molly?
Yeah.
And you're Vicky?
Yes.
Okay. So just reading through doctor's notes, you initially brought Molly in because she's having some unexplained fevers for a bit there. Is that correct?
Yeah.
About how long were those happening for?
I'd say about the last 2 weeks.
About 2 weeks. That's what we've got. So also she was kind of tired, seemed like.
Yeah, she doesn't want to play. She just wants to rest, and she's always sleepy, and it feels like something's not right.
Okay. Also, I noticed in her chart there was some rashes noted. Can you tell me more about those?
So on her chest, she's got these red pinpoint dots that have appeared. Yeah. I just noticed them a couple days ago, and I don't know what the correlation is, but they're there.
Okay. So yeah, about 3 days ago. After, so the fever started first, and then kind of came along after, and just weird, not her normal self. Okay. So Dr. Johnson, did he have a chance to come in and talk to you guys?
Yes, he came in and he told us the blood results, and it was a form of cancer, and it was a pretty common cancer. And I don't know much more than that.
Yeah, so the procedure she had done yesterday was that bone marrow biopsy. So that did show that she has a form of cancer. It's actually called acute lymphocytic leukemia. It's common in kids, but we can talk about that.
Acute lymphocytic leukemia. Molly, that's a really big word, isn't it?
Yeah.
All right. So within your body, you have blood, and in that blood, you have lots of teeny tiny different cells that we call red blood cells and white blood cells. And there are even more kinds of blood cells in those groups, but we're going to focus on those two. So the white blood cells within your body, those ones fight infection, and they're called lymphocytes. Can you say lymphocyte? I know, that's a really big word, and it's really hard to say. So your lymphocytes are your white blood cells. They are growing really fast in your body, and that's why we call it acute. That means really, really fast. It's happening really, really fast. And they're growing, and as they're growing, because they're growing so fast, they're a little messed up. So they aren't doing what they're supposed to, and they aren't fighting infection, and they're fighting the good cells in your body and attacking the good parts of your body because they don't, excuse me, they don't detect that they're good parts of your body. They think that they're an infection and they're trying to protect you. And that might make you feel really yucky.
All right. So acute lymphocytic leukemia is a little different. Cancerous commonly have stages like stage 1, stage 2. ALL has phases. So Molly is in the untreated phase right now. We're doing some more diagnostics. I'm just kind of coming up with a game plan as far as treatment. And the next stage would be in remission. So when the treatment has reduced or eliminated all signs and symptoms of the cancer. Relapse would be if the cancer would come back. And refractory is when Molly's body fails to respond to treatment. But the good news is that with treatment, it's manageable and has a high survival rate of patients living past 5 years of treatment of the cancer.
All right, so we did bring you in this flyer here. It just goes over more signs and symptoms of the illness. It shows you kind of what normal blood should look like, what Molly's blood looks like, gives you more of a breakdown, a little more in depth. Some different causes, really, we don't really know what caused Molly's case. That's for the doctor to determine, really. But she did go through that bone marrow biopsy, where you went to sleep and it drilled into your bone and got some bone marrow from the inside. Some signs and symptoms that are listed here. She had the fevers, the fatigue, the petechiae rash. That's the big fancy word for that rash that's on her chest. Some different treatment options. The doctor's going to probably come in and go through those more in depth with you. Some big words, but if you have any questions, make sure you ask. But there are informations here on the bottom, so if you have any questions for them here at the hospital or anything, feel free to give us a call. Okay? So,
Yes.
so while this is happening, Molly, you might feel really yucky and you might get cold and feel really tired or even like you're going to throw up. You might see some bruise marks on your skin when if you fall down the steps or fall off your bicycle, you might bruise really easily, those purple marks on your elbows. So I have a picture here. I have one for you and I have one for mommy. So this is a bunch of signs and symptoms. I'm just going to show the camera. Signs and symptoms that you might be feeling. So you might feel cold and really, really tired. That would maybe indicate that you had a fever or you're really tired, or you might see some more of that rash on your chest. So I want you to take this chart home and I want you to use it when you don't really know how to tell mommy you're not feeling good or how you're feeling. This will help you to explain how you're feeling and so that mommy can help you. So can you point to which one you might think you would point to if you feel like you're gonna throw up or be really sick? Yeah, that's right. So I'm gonna give that one to you and one to mommy so that you guys can take those home. Do you have any questions about the chart, Molly? No, Mom, do you understand it?
Yeah.
Okay. So you might want to laminate those. Just we printed some more resources for you there.
Yeah, so along with this as well, Molly may experience some pain related to the illness, as well as different treatment options that you and doctor are going to talk about. Our goal would be obviously to keep the pain manageable. What that looks like would be that Molly still does some of her normal activities of life, so she still gets up and plays. I know she has the fatigue right now and things like that, but you know, pain is going to be an indicator that she's not feeling well and that she's not going to want to play. So seeing things like playing, getting up and wanting to eat as much as she can, as much as her appetite allows, that's going to be kind of signs to show that she's not feeling too much pain. I also brought with our pain scale for her. So Molly, this chart here is some way that you can kind of help mommy to know how much pain you're in, okay? So the more sad the face gets, that's the more pain or hurt you feel. So if you can you show me where you're feeling right now? Green means you're feeling good and red means not so good. Okay, so you're having a little bit of pain. So with all of this, doctor will have some orders for you guys for some different pain medications and things like that. Based on her number and rating, you can do different treatments as well as some non-medication. So you can apply ice or reposition her. If it's her joints or if she has like a blood draw and that's bothersome, ice is always a good thing. Or again, repositioning, putting some pillows under her back, just getting her out of the one position she may be inclined to stay in. Any questions on any of that? No. Once the doctor has those medications, and some of the things can be over the counter and some of them can be prescription. So you can talk to him more about what would be better for, you know, the level of pain that she's in at that point in time too.
And then due to her acute lymphocytic leukemia, her immune system is already pretty weak and she's prone to infections. If she does chemotherapy, it'll also weaken her immune system. So it's important to take her temperature daily about the same time and just to monitor for signs of infection, such as a fever, sweats, chills, pain in her neck, or anything just kind of out of the normal for her. If you do notice anything, call the doctor right away. I think that number is in the back of that pamphlet that we gave you. And then our goal is to keep Molly free from infection, so we can do that. I have a little coloring page here, Molly. So if visitors come in, they might want to wear a mask. We want to maintain clean hands. Hand hygiene is really important. And then maybe they'll even bring you some ice cream.
Ooh, that sounds good.
So yeah, a big thing is just to avoid crowds, avoid people who are sick. And then don't share like eating utensils, dishes, cups, like that with Molly. And if she gets a cut from playing, it's important to clean it and bandage it and applying antiseptic on it right away. If you have any questions, I'll get this coloring page to you to take home.
Thank you.
No. Okay. So Molly, I printed off this big, huge coloring book so that when you go to your treatments, You can color in here. They might help you ask some questions that you might be thinking about. You could color a picture from mommy or even daddy or maybe one of your nurses. Okay, so I'll send that home with mom for you. And then it's also going to be very important to monitor what she's eating, making sure she's eating a well-balanced diet, that she's getting the protein she needs because our body uses protein to heal, and even monitoring for more signs and symptoms. As she goes through treatment, say she has chemotherapy, there's a symptom that you can get open sores in your mouth and your esophagus and your stomach, and those foods that are really acidic or even just different foods may upset her tummy that are she eats now. So you might have to get fine with that and maybe go to the grocery store, get some fruit, mash it up, and pour some juice and water in it, freeze it, make some popsicles or something. I do know that there's like Ensure protein shakes out there, and pudding and Jello cups that you can get for them. And of course, Pedialyte's always good if she's having a really hard time getting her fluids in. You want to make sure those electrolytes stay in. Do you have any questions about the information we've given you? I know it's a lot all at once. We're going to be here all day, so you can, if you think of something later.
Okay. Yeah, I'm just trying to digest it all.
Yeah. Molly, do you have any questions? No? All right.
So then, I know Nicole touched on it. Once you go home, there is that number of your doctor's office. Feel free to call at any time. And again, if you experience any fevers or anything like that, definitely let their office know about it. That's the oncology office. On discharge, you'll also have a bunch of appointments made. As long as everything's going good with treatment and patient and everything, oncology usually likes to see them monthly. There they'll follow up on how her pain's being controlled, how her nutrition's looking, making sure that she's not losing any weight or things like that beyond expected, of course. And then, just feel free to call with any questions or anything you need. Okay. Alrighty.
All right.
If you need anything, yep, give us a call.
Yeah.
Thank you.
Thanks so much.
Yes.